Today, we're talking about a very important concept that is really not appreciated at all in the current healing traditions, and that's what really makes the energy science application to treatment of disease so valuable. And literally, it's all about poor digestion. And as we go along, you'll understand how poor digestion can lead to flares, and most importantly, what we can do about it. Well, the slide is not moving. I wanted to really tell you how awesome it is to have you discussing things on these threads, because these are bringing up a lot of different comments that are really helpful for everyone's eye in terms of understanding this process. I did want to cover just briefly what we talked about in session 1, because this is just familiarizing, repeating what we've talked about, but also to give us a background for what we're going to talk about today. As we said, from an energy science perspective, nature is described in qualities, and all of those qualities are not only describing that which is outside you, but also that which is inside you. If the qualities outside you and the qualities inside you are the same, then the foods that you take in will either increase the qualities in your body because they're the same, or they'll decrease them or balance them out. So that's a very important concept, because when we take in foods that are not so obviously hot or don't necessarily carry the mobile qualities, then these qualities, when increased, will produce an imbalance, and that essentially produces what's called a Pitta-Vata imbalance, because Pitta and Vata are these energy patterns. Pitta has the characteristic of having the hot quality, and Vata has the characteristic quality of mobile. So therefore, when you take in foods that increase these two qualities, you then have the chance, not all the time, but you have the chance, or a person has the chance, of developing interstitial cystitis. Nutrition and aloe, as we said, are foundational in terms of therapy, and it's best to use the aloe vera gel rather than the juice, because the gel happens to be slow in its release. So it ends up affecting the whole bowel rather than just the upper segment of the bowel. We said that real healing takes time. If you're going to go to a gym and work out to get in shape, it's intuitive for everyone, I think, that you're not going to get in shape because you visited the gym twice. And it's the same thing when we talk about healing from an energy point of view. If we show the body that we're serious about what we're wanting to do, what we want to achieve, then it will happen for us. But we have to show the body that consistency of particular methods or consistency of various things that we're doing or taking are going to make a change for us. Well, So we've got some blank slides here. Let me delete them. We also said that from an energy perspective, disease is the accumulation of qualities. So the hot and mobile become overly expressed. They happen to be associated and affecting the bladder, particularly in your physiology. In someone else's physiology, these hot and mobile qualities might show up in joints or in the muscles and therefore produce fibromyalgia. Or there might be a large accumulation such that it changes the mucosa of the gut, and then you get irritable bowel syndrome or gastroesophageal reflux disease. We also said that disease is expressed in waves, and so that in any disease that you see, whether it's diabetes or GERD or pneumonia, any of these diseases that are expressed in waves. That is, there are symptoms that can pulse almost. And so you see that by this diagram that expressions of disease in the physiology occur in waves. And when there is healing that occurs, these release of qualities then lead to healing. But this release of qualities comes over time. It's not something that occurs right away. So as one starts to see improvement in the disease pattern, and you start moving in the direction of release, what happens is that you'll have good days and bad days. And so the flares will become less intense and less frequent, but they will occur because there's always this big question, am I getting better? And that's because these flares are occurring. It's not like you go from these large flares to zero. That's just not happening. And if you think about it, it seems almost counterintuitive that you would start feeling better immediately just by doing a few simple things. So it's an important concept to keep in mind as you go along in healing. No, I know. So this is the foundation of all IC therapy from an energy perspective, an energy science perspective. First of all, we want to keep foods that are coming into the body. We want to keep those aggravating foods from coming into our GI tract. So we want to stop the hot and mobile qualities. Predominantly, these foods are actually sour and salty and pungent, but it's very difficult sometimes to figure out which foods have these characteristics to them. So that's why the nutritional formats are so important. So that's what we essentially said in session 1, is that we want to start using these nutritional formats to stop the hot and mobile qualities from coming into the GI tract. But the second side, and this is what the rest of the webinar is going to be, is how do we aid the body to eliminate these hot and mobile qualities? And that's, in essence, what we want to go through. We also said that baby steps are really important, that the mind and body are intimately spliced, that you can't separate them. So if you're feeling hot because of the irritating symptoms in the bladder, you're also going to feel hot, angry, frustrated, and upset, because these are all characteristics of the pitta imbalance that is producing these hot symptoms in the pelvis. So you can also see that foods can produce anxiety and impatience. Now, we'll start on today's session. Digestive strength in the energy science terminology is called agni. We get the word ignite from the word agni. And when this agni is strong and well developed in our bodies, it keeps us out of problems and allows us to have clarity and strength, stamina, endurance. It's also described as the metabolism of the body, and it can be known as all of the enzyme and bacterial systems that run from the mouth to the colon. That's agni. That's the digestive fire. And so how well you digest food from an energy science perspective is also just as important as how well you digest thoughts. Because if you remember, mind and body are intimately spliced. You can't separate the mind and the body apart. So digestion of food is just as, talking about the digestion of food is just as valid as talking about how well and with what clarity you digest thoughts as well. So the agni dictum, if you will, the digestive strength or power or fire dictum, is that if your gut is healthy, you won't need any medicine. But if your gut is unhealthy and has poor agni, then all the medicines in the world will not help you. Because in essence, herbs can't be digested. Pharmaceuticals even can't be digested very well without this important aspect. It's said that you're only as healthy as your agni, that your longevity is only as good as your agni. So as you can see, it's a very, very important principle in terms of healing, which is completely not understood in our current healing discipline. We can measure our digesting of food by the symptoms we have and by looking at our tongue. This is a very important concept, that the tongue will tell you as you move along through your healing of IC, that the tongue will start changing, and it will show the loss of lines, the loss of coating. These will all be aspects that you would like to monitor. You get a baseline, an understanding of how you're looking, and then you proceed through the months and years watching your tongue shift and change. There's a joke in America that actually we have the most expensive stool in the world. And that's because many of us, I would say the vast majority, probably 90+% of us, have not very good agni. Most of the time, the reason for that is because we really don't understand the concept, so we don't know how to fix it. And we don't know how to monitor it, so we just slug away. Some people are fortunate with having good agni, but many of us struggle with it. Another concept is that this agni is not only in the GI tract, but it's throughout the entire body. And so other surfaces, such as the skin, the bladder, the vagina, they have linings that have agni, digestive capability. And so if we have poor agni, then we won't even be able to absorb the herbs that we place on the vagina or onto the bladder. Now, intimately associated with this concept of agni is the concept of ama. Ama is is residue that's left over from incompletely digested foods. And this residue, as you see in this campfire, with lots of charred remains and debris, this escapes through the microchyle of the GI tract to be distributed throughout the body. And some of it lands in the bladder, the vagina, the pelvic back muscles, the spine. And these areas then not only carry the hot and mobile qualities that get stuck in the pelvis, but these hot and mobile qualities are also associated with accumulated ama as well. So it's the qualities plus the ama, this undigested debris that has left the GI tract, that produces the long-standing and difficult to manage interstitial cystitis. That's it in a nutshell. We've come full circle now to understand why IC is such a difficult disease to treat. Number one, we don't know what to eat. Number two, we have poor digestive capability, which sticks these qualities in the area of the pelvis, so that we end up with difficulty eliminating them. The other aspect to this part of the IC equation is that these qualities are cumulative over time. That is, they build up over time. Let me just use this graph to show you how this works. Here you are happen to have an early on urinary tract infection, right? And you all have reported this in various ways in our communications and in the threads, etc., that have said, you know, I used to have these bladder infections, and then they would peak. The doctor gave me antibiotics. The symptoms went away. And then I was happy for a while. And then I moved back up into another urinary tract infection. This time, the doctor does a culture of the urine, and he says, well, Henrietta, I don't see that you have any infection present in your urine, but I'm going to give you some antibiotic anyway to see if that can help you. So he gives you the antibiotic, and you're happy because the symptoms go away. So this may occur several times over the early period of time of IC. And what this is just simply the qualities of mobile and hot locating in the bladder and in the pelvis. But then what happens is that these qualities they aren't being eliminated enough. They can't be removed fast enough. So now what you're seeing is that this accumulation of hot and mobile become so much over time that there comes a point when these qualities cannot be removed fast enough from the urinary tract. And then what happens is that there is the final diagnosis of IC, where people start getting improvement in their symptoms because they know now that what they have to do is change the way they eat. So they start changing the qualities in their diet so they get smart enough to start feeling better. But what happens is that ama sticks it in the bladder, sticks it in the pelvis, so that over time this ama is the thing that really is the problem that keeps our symptoms from getting healed. This is really nice, isn't it? It's pretty tough to write with a pen on this screen. So at any rate, what we have to do is we have to pay attention to ama as well. That has to be part of the formula of removing IC from the body. You can't heal IC unless you deal with this guy right here, ama. So let's go back. Let's see here. So what are the symptoms of weak digestion? And I think all of us can recognize some of these symptoms. Now for Vata, because of the mobile quality, if you remember, Vata has the mobile quality. And Vata is out of whack, so to speak. It's the energy pattern that's out of whack, and because it's out of whack, it has this mobile quality. What are the symptoms of ama associated with Vata? Well, bloating and gas and constipation, abdominal distension, irregular appetite, abdominal pain, dry skin, IBS-like symptoms. And of course, because it's a mind-body connection, insecurity, anxiety, worry, and fear. For Pitta, the signs of ama in the GI tract and elsewhere in the body: strong appetite, heartburn, acid indigestion. And if you take heartburn and acid indigestion to its maximal expression, it's called gastroesophageal reflux disease. Diarrhea, irritability, skin rashes, all are physical manifestations and expression, and of course, IC. And the impatience, the desire to control, these are aspects of Pitta in terms of the hot quality that occurs in the mind. Because the mind creates or has mental ama as well. So ama is not only physically expressed, but it's mentally expressed as well. People with IC then have combinations of Pitta and Vata ama. Let's see. Just wanted to cover one of the questions from one of the participants. Actually, it's been a couple. Has been this issue of bloating. What causes bloating? And as we said, it's related to ama because the foods aren't digested properly. This residue is left behind in the gut, and this residue is digested by gut flora, and produces gas. The bacteria in and of themselves can overgrow, and that produces gas, particularly the bad guys. And then yeast overgrowth, that's come up in our conversations on the threads about the issue of yeast overgrowth. And when you think about it, and we'll talk about this a little bit later, but yeast actually produces the hot and mobile qualities. So all three of these factors will produce distension of the gut with gas. This produces decreased motility. The gut can't move because it's stretched out from being distended. And the net result of this is bloating. The whole belly feels like you're pregnant. And that's related to just the abdominal distension that comes from the small bowel being distended, and actually the colon as well being distended and stretched out because of this gas. The acute signs of weak agni are poor appetite, feeling of heaviness, pain, a coated tongue that we talked about earlier, nausea, headache, weakness, fatigue, lethargy, muscle ache. You can see how fibromyalgia could easily fall into being associated with IC, because the weakness, fatigue, lethargy, and muscle ache, the headache, nausea, all of these are also symptoms of fibromyalgia. And of course, foul gas or flatus, bad-smelling feces, just related to all of the accumulated gas that you're experiencing. And this brings us to a very important principle that needs to be touched on regarding contrast. You know, we only learn by contrast, and that's why the energy science is so grounded on this information that all of nature is in opposite pairs, hot and cold, mobile and static, heavy and light. And so we only can appreciate hot if we know cold. We can't know hot if we don't know cold. We can't recognize that we feel heavy right now unless we start feeling lighter later. So the only way you know you're getting well is when you look back and you compare it to where you once were. The same thing occurs with respect to the heaviness of ama. You won't know that you're feeling lighter, that you won't know that you are feeling heavy now until you start feeling lighter with better agni down the line. And that's an important concept to get in mind, is that these principles of contrast is the way we associate and understand the energy field of the mind-body. So what are the long-standing signs of weak agni? Well, first of all, bad breath, tissue emaciation, emotional eating or food cravings, food allergies, and we'll talk about this in a little bit, insomnia, poor circulation. Sometimes people feel, oh, I have cold hands and cold feet, abnormal color, complexion, lack of luster, and of course the mental side of this, fear, grief, sadness, depression, confusion, which is a huge thing for people in the IC community. It's not necessarily just because they don't have answers, but it's also because the disease and the presence of ama produces confusion and also apathy. So what causes weak agni? Well, the choices that we have from that we're taking in from the no column or the avoid column, incompatible food combinations, drinking too much fluid, we'll talk about that in a bit, overeating, so we're putting too much fuel on the fire, and eating when not really hungry, that is, wet logs on the fire, because if we don't have really a strong campfire, if you will, then we, when we're eating, when we're not hungry, we're essentially putting things on the fire that can't be digested very well because we're not ready for the experience of food. And the same thing happens with overeating. We put so much fuel on the fire that the fire dies out, and the result is charred remains of the fire. I've got Trudy has a question, and I'm going to unmute you, Trudy. Do you still have a question? You raised it about 10 minutes ago, but okay. So so at any rate, let's move on, and What other things can cause a weak digestion? Well, not chewing foods completely, snacking between meals, it's a real big deal. Holding your breath while eating, eating while you're distracted, not taking time to appreciate what you're doing, or eating when you're emotionally upset, a lack of exercise, or stress. You know, athletes can eat almost anything if they're really actively exercising and really in top shape because of the exercise. They literally can burn anything, and it's because the agni is so strong. Also, stress can lead to problems of poor digestion because oftentimes it leads to distraction and irregular eating patterns, etc., etc. So digestive fire, like real healing, doesn't just automatically happen. You don't get it stronger with just a few manipulations. So again, it's the underscore here is that we just have to pay attention to working at it and doing our steps, and we'll talk about those in a minute. Dietary supplements, I believe, are really not very much help. There's oftentimes a use of supplements that, such as betaine hydrochloride, that supposedly stokes digestion. I don't have any problem with using it in a short term to get you maybe over the hump, but actually it's really more about lifestyle than it is taking supplements, and it'll save on your pocketbook anyway. It's what you do every day, therefore, that encourages strong agni. And then you'll be able to digest the medicines, and you'll be able to get better, and all things start with a good agni. So how do we improve it? Take the biggest meal at noon. Noon is a little bit strict, so I say between 10 a.m. and 2 p.m. in the afternoon. That's the time, that's the window of opportunity to take advantage of really helping you digest well and not forcing your GI tract to digest at times when your agni is not optimal. That's the key. You want to have your agni optimal if you're going to take the biggest meal, right? And along with what we've talked about earlier, don't overeat. So the rule of thumb is 2 handfuls. What you can put in your hands, in your 2 hands, and maybe use as a visual a bowl. So get a bowl out of the cupboard, put that bowl in your 2 hands, and then you have kind of a visual as to how much you should eat at any one meal. Another thing is to use what is called ginger pickle. Ginger pickle is it's a dime-sized piece of fresh ginger, finely chopped, a piece of rock salt or mineral salt, a few drops of fresh lime, not lemon, because lemon is too hot, but fresh lime is great. And put that together and chew that before a meal, just to get the agni stoked a little bit. This ginger pickle will stimulate agni. Use cooling spices in your, or what are called churns, in your cooking. Avoid raw food, so all vegetables should be lightly steamed. Just try this experiment. Take a raw green bean and chew on that, and notice the cellulose, and then steam that same green bean, and then notice how easy it is to chew. But that cellulose is being broken down when you cook the food. So what you're doing is you're using the agni of the stove, the heat of the stove, to break down early or prematurely before you eat it and consume it, you're taking that raw food and applying external heat to it in order to bring it into a form that is going to be easy to digest, or what I should say, easier to digest. Juicing is good, but just avoid fruits with veggies. Fruits don't belong with any other thing but themselves, and so veggies should be the main way that main thing that you're juicing. Using parsley and cilantro as garnish is a good way to improve agni, and avoiding excessive fluid intake. Now, these churns that I was telling you about is for us, the Pitta Vata churn would be equal portions of cumin, coriander, turmeric, cardamom, sea salt, and fennel seeds. You mix this together in a container, and then you use it in everything. If you're putting something in the skillet to cook with a little bit of oil, put some churn in with that and cook with the churn, because that will help improve the digestion, your own digestion. Also, other things to do, you can see that there's a lot of different things that we can do for agni, and we'll get to what you can do at the end here. But khichdi is a very easy food to digest, and maybe if you're interested, as we go along here in these sessions, we can do a session on khichdi and a Q&A. Ghee is clarified butter, and it aids in bringing ama back to the GI tract for elimination. So it's a very important substance. It's essentially unsalted butter that is devoid of the fatty acids in the butter, and we can talk about that if you're interested as we move along. Honey can be used in moderation, and it's heating, and so it can increase agni. Ice is not nice. Ice cools down the digestive system. It cools down the body. So when you use ice, you're essentially cooling your body off, and it's essentially like putting, cold water on your campfire, and it's not healthy. We've gotten into a very bad habit of having ice served to us at restaurants, using ice at home. Oftentimes the reason people use ice is because they are feeling hot, and they feel like they just got to cool off, and so they think that ice is a great way to do that. But in actuality, they're just compounding the problem. They're feeling hot from the pitta imbalance, and then on top of that, they start using ice, which cools down their digestion and affects their ability to heal themselves. Also, watch for incompatible food combinations. We talked about the issue of fluids. Fluid volumes are important because, it's too much or too little, but everything is just right. A good guideline is if you can see your urine is light, pale yellow, that's great. That is probably your volume in your body is appropriate. The kidneys are a great way to show us how much volume we're behind or how much we're ahead. For Vata, if people were just completely Vata, 70 to 80 ounces of fluid a day. If you're Pitta, 50 to 60 ounces. And for Kaphas, 40 to 50 ounces. So these totals are for everything, including fluids with meals, including soups, etc. So if you're Vata Pitta, probably somewhere around 60-65 ounces of fluid a day is good. But no more than that, because then you would be diluting out your digestive power or strength or fire, agni. They all mean the same thing. Try not to eat large meals late at night. Drink milk separate from meals. And make a deal with yourself that anytime you're going to put anything in your mouth to eat, that you make a deal with yourself that you're going to sit down, but not behind the wheel of a car. Sitting down, even if it's just one grape, sit down for that one grape and really pay attention. And it seems rather unusual, but this really can improve agni. If you just put your attention on what you're doing, it will help improve your agni, because a component or an aspect of agni is attention. Agni, when it's strong, allows you to pay attention. And so when we start creating the habit of paying attention to digestion, we improve our digestion. Lastly, do at least one meal every 2 or 3 days in silence to focus the attention on what you're doing, like we just said. So what herbs can be used to improve agni? Well, our friend CCFT is a great way to improve agni. So many of you have started using this, and it is one of the best things besides aloe that you can do. And the reason is that it improves your agni. Cumin and coriander and fennel are all unique in that they are cooling to the GI tract, yet they promote the heat of agni. So they're very, very useful in terms of getting us healthier, in terms of healing our GI tract, and hence IC. Fresh ginger, the dry ginger is too hot, but fresh ginger is excellent to use. Also, triphala can improve agni, and we'll talk about that in a bit. Colostrum, like we've related in the thread, is really good for bucking up agni, because it not only stimulates, it not only cools off the physiology, it's an anti-inflammatory, so it's anti-hot, but it also helps buck up agni. So it's a powerful medication to use as a supplement. Probiotics, along these same lines, by using a probiotic, you can improve your agni, because remember, we said all of the enzyme systems and the bacterial systems from the mouth to the colon are related to agni. They essentially are agni. So when you put a lot of the good guys down there, you enhance agni. Triphala is the ultimate bowel tonic, and it's good to titrate according to your constipation pattern. If you are constipated, a half a teaspoon at night may not be enough. You may have to put it up to a teaspoon at night, and see what happens over a week to see if you can start having a regular bowel movement in the morning. Triphala means the three fruits. Tri from three means three, and phala means the fruits. And these fruits, each one of them pacifies vata and pitta and kapha. There are the teas that we talked about, so CCF tea can be used, but cumin, coriander, and fennel can also be used in your cooking, like we've talked about earlier. Fresh grated ginger tea is excellent because the essence of the ginger gets out into the hot water that you're drinking, hence enhances agni. And agni tea, which the recipe is here, is 1 quart of water with a half to an inch of chopped ginger root, pinch of cayenne pepper, just a small amount of cayenne, or better yet, maybe something like nutmeg, because cayenne is so hot. And 1 to 2 teaspoons of rock salt or mineral salt, 2 tablespoons of sucanat, which is crystallized cane sugar. Bring that up to a boil, let it set, strain it, and then sip it through the day. That will also stoke agni. So short-term simple solutions for helping with agni is just don't eat when your agni is low, because it's like putting wet logs on a campfire that's almost out. Fasting can be of value, but you have to really be careful about fasting if you're really debilitated or emaciated, you're having trouble with weight. Fasting with doing a water fast would not be appropriate for you in that situation. But a juice fast could be pretty good, or using agni teas, but you have to watch it to be sure that you don't get too hungry during the day. The key is never eat if your appetite isn't really strong. Wait for the appetite to get strong, because the appetite is a great barometer to tell you when your agni is strong. So what can you look forward to when your agni is revved up? Well, you'll be able to visit occasionally the no column. You'll be able to use incompatible food combinations on occasion. And you'll be able to go to dinner or to a friend's home or to a restaurant and not have to worry about compromising what you're going to eat. In other words, you won't be painted into that proverbial kitchen corner where all of your selections of foods have been chopped off one by one. But you'll only be able to do these things for 1 or 2 days, because your body will begin letting you know, because if you're using your agni up, if you're putting on too many of those logs, then what will happen is your digestion will start going down and your body will tell you. So in summary, we've talked about this concept of agni, that weak digestion is a major contributor to all disease. The symptoms of weak digestion are related to this morbid gooey substance called ama that leaves the GI tract and is distributed to the rest of the body. We talked about a lot of different lifestyle choices to improve digestion, and we also discussed those things, those herbs that can improve agni. So for your homework this week, what I would suggest is that you try 3 things from our How to Improve Your Agni list and do them for the week. Just try to get some of these incorporated. It can be as simple as just taking your biggest meal at noon, or doing an agni tea, or still doing CCFT, but try to add 3 more new things. And continue to choose 3 more no or avoid foods off of your list. Try to substitute those with the yes column. And then lastly, why don't we start trying to scrape the tongue every morning? Read those tongue lines and the coating on the tongue, because this, as we talked about earlier, is a great agni barometer. But interestingly, scraping the tongue also stimulates agni, which is very interesting, but is very helpful for you in the morning when you're getting up. So this brings us to Q&A, and are there any questions so far? You can just use your yellow hand. Okay, so we'll go ahead and start with some questions that have come up for you during this session, this last session, and right now. There's been some talk about yeast and the problem with yeast in our threads. And one of the things is, why is yeast not good for people with IC, or for that matter, anybody for anybody, because yeast really is not good to, yeasted products in general are not good to use. Yeast has the two qualities that we're trying to avoid, the hot and the mobile. If you think about it, the picture here on the slide is that of a dough rising out of a kitchen container, a bowl sitting on the stove, and these yeasties are growing. And how do you know they're growing or they're doing their thing? Because the bowl on the side feels warm. So yeast, when they grow, when they eat things, they're eating that dough, they're eating materials in your GI tract, they're producing the hot quality. So that's an important aspect of yeast. The second is that the yeast rises. Why does yeast rise? Because it's producing gas as a byproduct of its metabolism. And we already have talked about the bloating that can occur when you have AMA in the GI tract. So the gas is essentially mobile. So the mobile quality is being introduced as well with yeast. So this is the reason why yeasted bread products should be really avoided with the plague. What's the substitute? Actually, flatbreads of any kind, tortilla, wraps, pita breads, I think, are yeasted to some degree, but they're actually perhaps better than the yeasted bread or other products that we can ingest. But flatbreads like tortilla are best. Food intolerances have come up on threads all over the place when you read and talk about IC, and everybody's talking about how if they they're gluten intolerant or they're lactose intolerant, and it's and that when they eliminate those things, they actually do better. And that's because they're not taking these challenging large molecules, lactose and gluten, in their diet, and so they're not putting the stress on their agni. But the real problem still exists. They have lousy agni. So the problem is to improve the agni, and the intolerances will pass. They will go away, I guarantee you. There's not really an issue with these intolerances, or what are called food allergies. This is related to agni. Breath techniques such as breathing, we'll go over these if you're interested in the future, but breath techniques can also help improve agni. There are specific yogic breath techniques such as Kapalabhati, Bhastrika, Anulom Vilom, Ujjayi. These are all very helpful breath techniques that can buck up agni. Also, there's been some discussion about constipation and about the issue of how to manage it. Well, first of all, I think we need to define what constipation is. And from an energy science perspective, every morning one should have a bowel movement. One of the first things you do after drinking a glass of water would be to have a bowel movement. And then a bowel movement usually 2 hours after a large meal. Now, by this definition, almost everyone on the planet might be considered constipated at some time in their life. But the key is to realize that this is the goal. This is the um, the kind of the level at which we would want to be working if we were optimally healthy. So we want to strive toward this. It's not that we're going to get this within the next 6 months or so, but to move in this direction is the goal. So a very common problem. This is a very, very common problem in Vata-Pitta disorders, such as IC or irritable bowel syndrome, which also happens to be a Vata-Pitta disorder, both associated in a chronic state with ama. So ama is almost always associated with these conditions. So what do we do to manage constipation? Well, everything that I've talked about today should be looked at in terms of how to remove ama and hence improve the constipation picture. Triphala can be used, and as we talked about, Triphala is a wonderful agent to get the bowels balanced, but also to help them move the colon so that the colon can function more effectively. And so increasing the amount of Triphala to the point where you're having a bowel movement every day would be a good thing to use. And lastly, there are medicated herbal suppositories that we can talk about later that can be used not only for the bladder, the vagina, but also for colonic function. Well, the other side of constipation is obviously diarrhea, and in general, this is a Pitta Vata disorder where there is so much hot quality in the small bowel that goes into the colon that it increases the gut motility of the small bowel and the colon. That is to say, the hot quality stimulates the mobile quality, and because of that, diarrhea occurs. In this setting, as in constipation, ama is almost always associated with this condition. And the treatment management for diarrhea is to burn off the ama, that is, reduce the hot quality. So doing all of this nutritional work that we've talked about and to do or improve your agni to burn off the ama is also really, really important. Psyllium husk is something that you can find in the grocery stores, also in health food stores, or you can even get it online. And this is a really good agent to use because it absorbs the hot quality in the small bowel so that it reduces the motility of the gut and hence reduces the risk of having increased diarrhea. If you're really in a bind and the diarrhea is overwhelming and psyllium will not touch it, as well as lifestyle choices, the thing that will shut it off for sure, it will completely shut off the bowel, is fresh yogurt. You have to make fresh homemade yogurt. It's not good enough to use fresh store-bought yogurt, but fresh homemade yogurt, about a tablespoon of ghee, and sucanat, which is crystallized cane sugar. Using these three agents together and only eating that for about a week to 2 weeks will stop your diarrhea. Also, we talked about these breathing sequences that can be used to reduce ama. These can also be these also can help reduce the ama in the GI tract, which is in part playing a role in the production of the diarrhea. So I think that concludes what I have to say. Does anybody have any questions that you want to raise your yellow hand with and talk, or otherwise, I guess what we'll do is, everybody breathing still? Can you raise your hand if you're breathing? Oh, good, good. All right, very good. Well, thank you again, and thanks for your patience in terms of Tuesday. And fortunately now we all have it set, and so you'll be receiving reminders to go and register for the session for the upcoming webinar next Tuesday. Next Tuesday we're going to cover how to deal with the acute flare and what things we can do in order to reduce the symptoms of the flare. And so as always, I would appreciate you giving me your questions about that topic when they come to you on the next email that'll be sent out probably on Friday or Saturday. And then I'll be able to incorporate that information into your questions or into the material for next Tuesday. So at this point, I think we can conclude. And thank you very much for your attention, your patience, and we'll talk to you next week. Bye-bye.